So when I do rib remodeling, I use the piezotome. It's this device, and it goes in tiny little area in the skin, and this is what actually cuts the rib. So it's very small, it's very precise, and it doesn't leave any big scars or big incisions. So we call that the piezotome. All right, so what we're looking at is an ultrasound. I love using the ultrasound because it allows me to delineate my anatomy and helps keep me safe. So her 12th rib is too short to do anything with, so we're not breaking that 12th rib today. But you see this little white line here in the center of the screen, that's her 11th rib, and that's her 10th rib, and then the 9th rib, and so forth. So these are the ribs we kind of go for, but using the ultrasound, it helps keep us away from the lung. The lung is actually below at the bottom of the screen. Sometimes you can see it moving back and forth there. And our goal is to avoid injury to that lung. So here I have Exparel and some other numbing medicine that I always inject over the ribs just for post-operative pain control. See how close the lung is? It's sliding right under the rib. So if you don't know how to use an ultrasound or you don't know your anatomy well, it's very easy to injure the lung. So safety first. This piezotome, it actually puts out water which helps cool the blade underneath the skin. It doesn't cut me because it only has the propensity to cut bone. But the water helps to avoid skin burns or burns to the bone. Once I've sufficiently cut the bone there, then I'm going to apply some pressure. And sometimes you hear a bone break, sometimes you don't, but it's more about feel. So if you want to zoom in close here, you can see where I went through the skin. And so I find the rib that I've already cut, and then you heard that little pop, and that was just a fracture of the rib, not a complete fracture. It's what we call a green stick, or just a partial rib fracture, and that's what's going to bring that waist in. Right here. So that sound you heard, that's just a one-sided fracture of the rib, and now that rib is partially fractured, and that corset will help to bring it in. So back in the day when people removed ribs, you would see large scars on their back. With rib remodeling, with Dre sculpt technique, you see how tiny these little incisions are, just those small little poke holes, and those will heal fine when it's all said and done. I'm gonna inject just a little bit more pain medicine so she has some good post-op pain relief. This is a numbing medicine mixed with some Exparel, which is a long-acting pain medicine. So if you look at the screen here, I'm pressing down on the rib and you can see where it's fractured, where it bends right there. And so it kind of shows the importance of when you're not wearing a corset, then you're not gonna get that in fracture of the rib, but when you're wearing it, you're going to get this new shape and the bone's going to heal in that new position. Everything looks good and the lung is intact. And that's it, that's rib remodeling. So we'll zoom in here just so you can see the incisions one more time. Rib remodeling, no big incisions, small little punctures in the skin with a needle. Lipo 400, notice there's no scars around the butt on the top, no scars on the side, no scars below the butt. Lipo 400, no scars anywhere on the back. Dre sculpt.